Hi, today is May 15, 2021, and the weather has become nice. I love summer, especially love to wear shorts. But about 25 of all the adults have some trouble because they have varicose or have varicose veins. It looks like very uncomfortable feeling about your legs. Usually you have chest swelling and large veins on your leg, and really sometimes to bother you to have shorts. And yeah, I know everyone will be, if you have varicose vein, you may have one to things to do to how to prevent it from happening, and also if there is, you want to find out what is the cause of the varicose veins. And so before we go into detail the causes of varicose veins, let's have a look at the difference between healthy veins and varicose veins. And here's the picture. So in the left side is healthy veins, and in the right side is diseased or varicose veins. And of course there are many physiological difference between this healthy veins and diseased veins. And one of the biggest factor which cause varicose veins because defect on this vein valves. And here's normal one. So in the varicose vein, this vein valve is damaged. Well, what this means that when the blood from leg move to the heart, in the normal veins usually have all, when the blood pass through this valves, and usually the closing completely, so the blood will not going to move back to the lower leg. But in this varicose vein, this valves is have damage, so they cannot close completely, so the blood will flow back. That's why cause varicose veins. Hey, you just showed picture. See, in the normal veins, you see that they have very clear, when the blood close, the valves will be closed completely, so can prevent this blood move back. However, in this vein, in this varicose veins, see that this valve is not complete closed, so blood will move back, thus cause the retaining of blood in the leg. That's called varicose veins. So with this in mind, now we're going to look in details what is the cause of varicose veins. So in most of cases, usually you don't find exact causes, and so the reason for the varicose vein usually is complicated. And first of all, and family history. So it's related with genes you have. We know the varicose veins often runs in families, and if your parents have varicose veins, the chance of you have varicose veins will be increased significantly, because you get genes from your parents, and that genes was related to this physiology of the blood vessels. Usually in this case, you cannot do anything, or if you like to know exactly what is gene in your body which is responsible to varicose vein. Now there's a genetic test. You may find out what is wrong with your genes. Yeah, that's the possibility. Age is very, very important factors for the varicose veins, because usually the varicose vein, just like any organs in your body, is kind of have damage because wears, tears, and that will cause some kind of weakness of the veins and the valves of veins. And in many of the cases, when you put more pressure on the veins, that also can cause varicose. Here just show 3 examples. For example, it's standing for a long period of time, and some people have obesity, and some people have chronic constipation. In all these 3 situations, and they cause the vein to have much more work to do, and in terms stand for a long time, because then all the blood, because gravity, the force your veins to do much more work. Same is to obesity and chronic constipation. They also put huge pressure on the veins. And so if you have this case, such case maybe, and this is way you can learn something to try to prevent this from happening. Another important is sex. Usually females have much more chance of suffering from this varicose vein, and because be a female, a lot of female hormones which tend to relax vein walls. So because it relaxed, so the power of veins was reduced, and then you can have the blood retained in the leg. And also, if you have pregnancy and you have baby, and during pregnancy, usually the blood volumes is increased significantly. So that means your body needs to work very hard, and this kind of pressure was put on the leg, and much more work for the leg to move the blood from leg to the heart. And another thing is that being inactive may be disadvantage, because we know the veins don't have any power to contract, to push the blood from legs to the heart, but the muscle is one of the most powers to force blood from in the veins go to the heart. So if you are not inactive, the muscle become weak, and that will cause blood return in the vein, especially in the leg. And in another case, many people may not know. Sometimes you don't know that you have leg injury, and the injury in most cases may be the valves of vein, the vein valves damage, and that's as shown in the picture. That is the most important factors for varicose vein. And another factor is smoking, and so that's not only smoking by itself, but most cases, and people have secondhand smoking. We know smoking will cause some kind of damage to blood circulation, and so if blood circulation become weak, so this blood will be left in your leg, and that will contribute to the formation of varicose vein. So again, that most cases, and the causes of varicose veins are complicated. So you need really try hard to look at your situation. And this is first step for you. You need to find the cause. And with this in mind, then you have the potential just to correct this mistake you made or damage you already done. And this first step, I think, if you know the cause, then I know you are more than half done. And that's the talk for today. We just discussed the causes of varicose vein. And I wish to see you in my next video. Bye.